Welcome to part 2 of Question Strategies for Taking the CPC, the Certified Professional Coder Exam from AAPC. What we're going to do with each one of these is read through the question and then decide on our keywords. And based on that, I'll show you how I would look at each one of these questions and attempt to answer them. So the first one says, how would you code it if a patient had confusion due to the fact she accidentally underdosed her methadone? Well, let's take a look to see what keywords we've figured out. Okay, there's confusion, accidentally underdosed. That's an important one because anything dealing with the drugs, you'll have some specific categories and you'll see them in a moment. And methadone. Now, as I look at the answers, I see R41. See, it's here, down in part B, down in C, and down in D. It's in every answer, so I'm not going to even look at that code. I'm going to look at the T codes and see if I can make the decision on what the answer might be. I'm only going to read what R41.0 is if I can't figure it out based on the T codes. So let's look at the T codes. As I was mentioning, each specific code has a category it belongs to. You can see here that the last number, a 1, accidental poisoning. Then we have a 2 for intentional self-harm. 3 is 3x5a, adverse effect. And the last one's the one we need because it specifically says underdosing, and underdosed is one of our keywords. So it's T40.3x6a is the answer, and the answer does live up in A. When you look at this one, it's pretty obvious that's the answer. There's no other different T codes in any of the questions. Now, let me pose this to you, though. If you had one answer that was R41.0 and then the T code for the 3x6a, and then you had a second one that said T40.3x6a, then the R code, you would have to figure out the order of precedence. Which one would come in first? Well, this person's confused. That is definitely the symptom that you're looking for. And then after you get in there and they get evaluated, they figure out it was due to underdosing. So the R code would come first, the confusion. You wouldn't have the T code first. So let's look at the next one. A patient comes into the ED with complaints of flank pain, difficulty urinating, and blood in their urine. After CAT scan, the doctor indicated that the patient had a kidney stone. Let's take a look and see what our keywords are. Well, ED or ER, whichever one you're most comfortable with. Flank pain, difficulty urinating, blood in the urine, and then the patient had a kidney stone. As I look at my answers, I have A and B with just one code each. Then I have C and D with like 4 of them. There is a guideline that states if you know the diagnosis, you do not code the symptoms. So I have a diagnosis. The doctor indicated the patient had a kidney stone, so that's the diagnosis. And as I look at C and D, they're full of a bunch of codes, but I'm only trying to cover one diagnosis. Well, with that being said, there could be a need for 2 codes, but 4? Doubtful. So I'm going to look at A and B. I have N20.0 and N20.1. So let's take a peek. N20.0 is calculus of the kidney, and 20.1 is of the ureter. So I need A, N20.0. So I used a guideline to narrow down what I had to look for in this question. Let's continue on. A 39-year-old woman has found a lump in her left breast. Since she had a malignant lesion in the same breast in the past year, she saw her doctor and a biopsy is scheduled on the left breast. Which are the appropriate ICD-10 codes? Well, let's look at the keywords. So we found something in her left breast, malignant lesion in the same breast in the past, and she's being scheduled for a biopsy. As I look at my answers, I see A and D both have a C code. The easiest way I've always remembered C codes is C is for cancer. But this woman doesn't have cancer. She had cancer, but we don't know if it's malignant or benign. So A or D wouldn't be your answer. So if we look back again, we have B and C. You may not be as familiar with D. Did I say B? I apologize. D, but D is a lot of the benign stuff, benign tumors, items like that. Your answer is actually B, and I didn't even crack open a book to try to figure it out. Did it based on the fact I knew that C's were codes that held cancer codes, and the D was a code that handled the benign code. So what is N63.20? So N63.20 is an unspecified lump in left breast unspecified quadrant. And your Z85.3 is your personal history of neoplasm of the left breast. Personal history, not family. And you can see both C codes here, malignant, and the D24.2 are the benign. So by knowing that the C chapter hold the cancer codes and the D chapter can hold the benign codes, it led me to the answer without even looking. Now, one thing to remember though is as you go through this, if you're not sure, look. I'm just trying to show you the way I go through things. A 55-year-old male visited his cardiologist and is going to have a cardiovascular stress test today with physician supervision, interpretation of the results, and a report. However, halfway through the test, the man experienced pain in his left leg and couldn't continue. The test is rescheduled for a later time. What is the appropriate CPT code that is reported? Well, when I look at this, I know that he couldn't finish the test. So they can't take full credit for the test. He didn't finish it. But they can have partial credit. So look at C and D. They have a 52 at the end. Discontinued service. Here are the items we're looking for. Cardiovascular stress test today with physician supervision, interpretation of the results, and a report. And that he couldn't continue. And as we already know, discontinued services for 52. So 93018, it is a cardiovascular stress test, but if you look down toward the last few words, with interpretation and report only. But if you look down at the bottom of the cardiovascular stress test, 93015, there is supervision, interpretation, and report. That fits our keywords a lot better than this 23018. So it is 23015. And remember that if for any reason somebody can't continue something, it's a discontinued service. You can't give full credit or full reimbursement for something that wasn't finished. All right, here is the doctor ordered a comprehensive metabolic panel 80053 and a renal panel 80069. What CPT codes do you use? Well, I can tell you that you are not going to just use the code for the comprehensive metabolic panel and a renal panel. There could be tests that overlap, and there are. So let me bring it over to the next page here. We're seeing the comprehensive metabolic panel and renal panel. I'm bringing this up purposely like this one here, just to show you. Now we have 800-53. Everything from 800-69 fits into the 53 except for 84100, which is phosphorus inorganic phosphate 84100. So to properly code this, that they did a comprehensive metabolic panel and a renal panel, you look to see what's copied between the two of them, and you only code what's not there. So in this case, I have 853 because it takes over most of the renal panel, except for 84100, which isn't part of the comprehensive panel. Now, if it had been part of the comprehensive panel, then we would only have 853, but it's not. And I want to thank you for being part of this little video. Thank you.